Hello, and welcome to Automated Electronic Forms for Child Care Providers. My name is Fred Messing. I developed this service, and I'm proud to tell you that thousands of families across the United States register their children for child care using our electronic forms that automate the collection, tracking, use, and record keeping of enrollment, licensing, and income eligibility forms. The parents complete online electronic forms on an access-controlled, secure website. We customize the electronic forms to meet the licensing requirements in each jurisdiction, and we also customize them to meet each provider's individual needs. When the parents click the Submit button, you will receive an email notifying you that a new form has been submitted, and your administrator receives all of the electronic form information for all of your children in a scheduled spreadsheet report. We ask the parents to establish a username and password for 3 reasons. This enables them to partially complete the form and return later to enter additional information. Maybe they didn't have all the information they needed. Maybe they were interrupted by one of their children. They just save the work they've done so far, come back later, sign in with their username and password. All the information previously submitted is still there. They complete the form and click the Submit button. After initial registration, changes often occur. The parents just sign back in with the username and password, update their form with just the new information. All their old information remains there. Maybe it's a new phone number, maybe a new pickup authorization. Whatever it is, they enter the new information, they click the Submit button, you're notified by email, and your report is updated, so you always have the latest information. And when they need to re-register their child for a new year, nothing could be easier. Sign back in, make any changes necessary, update the signature date, click the Submit button, they're registered for a new year. Let's take a look at a sample form so you can see some of the capabilities that we can provide. This form is customized for Maryland. As I said, we'll customize it for any jurisdiction in the United States. We usually start out with a child information section. The parents just type in the child's name. If the child has a preferred name, we can type that in here. Parents select the child's gender, date of birth, language spoken at home. You'll notice that defaults to English because most of the children, that's their language spoken at home. But if they have a different language, the parents just type it in. And if you have grade school children, we can have a pull down to select a grade. Most states require an address for the child. And you'll notice that here, the state defaults to Maryland. But if the child lives in a different state, just click, select that state, and now the child is registered in the state of Delaware, living in the state of Delaware. We usually follow the child section with a program section. This is completely customized to your individual needs. So often we have a school year, location, if there are multiple locations. If you have different durations, we can have full day and partial day program. The parents can select the days of the week for their children to attend. If you have, for example, 2- and 3-day programs, we'll set it up that way. If you have supplementary programs like early arrival, lunch, or enrichment programs, we can have the parents select that right here. And if you have alternate arrival times that you want to arrange for each child, we can have fields for that as well. Whatever you need, if you can put it on a paper form, we can put it on your electronic form. This is usually followed by an office use only section. This section is generally not visible to the parents. This is where that you will assign each child to their class. You can put in enrollment dates if you want, withdrawal dates, tuition deposit amounts, any information that you want to append to the parent's form, we can set up a field for you to enter it, and the parents cannot even see this field. That is usually followed by a section for the parents to enter their information. They enter their name and their relationship to the child. This is where we allow the parents to self-identify their relationship. That allows for non-traditional families and avoids any discomfort in the parents identifying their relationship to the child. Again, the state is defaulted to Maryland. For your form, it'll be defaulted to your state, but the parents can select any state that they happen to live in. We provide phone number fields, typically 3. Rather than the traditional home, work, and cell phone, we normally structure this with primary, second, and third phone. That way the parents can tell you which is the phone number I want you to call me on first. And they can identify the phone type with this little pull down here. Most centers are communicating at least part-time with their parents via email, so we'll have an email section. And many centers want to include employment information. We can provide fields for that as well. And of course, we provide space for a second parent with the same information available. Some optional fields that some centers want to use. We can put in the names of family or household members and any information about them that you want to collect. Some centers want to send monthly newsletters or special event announcements to relevant friends. We can have a section for that as well. Everybody needs to know who the child can be released to for pickup purposes, so we can provide as many of those as you want, and any information you want about the pickup we can put in here, including multiple telephones, addresses, email addresses, whatever you want, we can add the fields, and any number that you want, we can accommodate. The authorization section allows the parents to authorize you for anything that you need their permission for. Typically, centers want permission to use photographs and videos for their promotional materials or internal use. So we'll provide a field for the parents to say yes or no, and we can structure this any way you want. Skin products are often require authorization from the parents. Again, we can structure this however you want. Here we've got it set up for a general skin product authorization, and the parents list here the names of the products. But if you have your own products, we can list those. If you want to do it separately for sunscreen, insect repellent, and diaper cream, we can do that. However you want it structured, we can restructure the section to meet your needs. And then there are the authorizations for various activities. Anything that you want the parents to be able to say yes or no to, we can include in this section. Emergency contacts, a very important part of your form. Again, we can have as many as you want. Any information you want to know about each emergency contact, we can put a field in to capture it. We can even include emergency medical contacts, such as a physician and hospital. In Maryland, child care providers are required to give all parents access to a document called the Parent's Guide to Regulated Child Care. This document is written by the State Department of Education. We provide a link here to the Department of Education website. The parents click on it, they download the latest version of the form, and then they can certify that they've received it by clicking the yes box over here. We can do this with any documentation, whether it's state documentation or it's your own documentation, such as a parent handbook or a discipline guide. Whatever you want, we can provide the links here so the parents can download it, and we can provide boxes to enable them to certify that they've received the information. Most centers collect some medical information, so we provide fields here for the parents to type in whatever it is that they need to tell you about their child. And they can include allergies, medications, conditions, developmental concerns. We can make this as detailed as you want. Some schools want to know about toilet training. Some schools want to know about sleeping habits. Some schools want to know about fears. Whatever you want to know about the child, we can provide a field for the parents to type in that information. Health forms are another key part of child registration. Those forms need to be completed generally by the physician, so we provide links to download the blank forms so parents can provide them to their physicians to complete. But in addition, we provide fields for key information that you need to be entered into the form. For example, the date of the last physical examination. This will enable you, and you'll see that a little bit later, to keep track of when this child needs to get another physical exam so that you can get the updated health care form and not have your healthcare forms expire without your knowing about it. We provide similar information about immunizations. You'll notice here the parents can tell you whether their child is exempt from immunization. Since most children are required to be immunized, the form defaults to required, but the parent can click the exempt button. Similarly with the varicella vaccine, if a child has had chicken pox, they may be exempt from that, so the parents can click the exempt button for that as well. And then for each vaccine that is required in your state, we provide fields to enter the number of doses that the child has already had. Some centers have the parents fill in all this medical information. Some centers prefer not to have the parents do it and have their internal administrative staff do it. In that case, we hide all these fields from the parents, and only the administrative staff can enter the information. That's entirely your choice. We'll set it up exactly the way you want it set up. If you collect medical insurance information, we can provide fields for that. If you administer medication to the children, we can provide an option for the parents to say yes or no. If they say yes, then fields will pop up to enable the parents to put in the information you need to be able to administer the medication. And finally, at the bottom, the parents type in their name, which serves as their electronic signature. Every state in the United States accepts electronic signatures as the legal equivalent to a paper signature completed with pen and ink. So this is completely legal in every state of the United States. Once the parents have finished completing the form, they click the submit button. I'm not going to do that today because I didn't actually finish the form. So we'll just go back to the presentation at this point. As I said, your administrator will receive a report with all the information for all the children. This is just a spreadsheet. The column headers are the field names from the form, and there's one row for each child. Typical forms have 200 fields, which means 200 columns in the spreadsheet. If you have 50 children and 200 columns, you now have 10,000 pieces of information to manage your center. Nobody has the time or money to type all this information from paper forms. But with electronic forms, the parents type in all the information, which they would have had to write on the paper forms anyway, and now you have it on your desktop to do whatever you want. By itself, it's complicated to use that very large form, so I'm going to provide you with desktop tools to automate the tracking and use of the forms. These tools are all implemented using the desktop software you already have, Excel, Word, and any browser. No new software is installed on your computers. So let's walk through some of the tools that we have. This is the automatic tracking tool. You'll see here it automatically creates a list of the children who are registered. It shows the classes that you've assigned them to. Many centers have a cutoff date. A child who reaches a certain age on a certain date can enter a certain class. Whatever your cutoff date is, you just tell me. We'll set that up for that particular date, and you'll see the age of the child on that date to help you assign them to classes. And, of course, it updates every year. Here, we can tell you if the parents have submitted the contact information that you need. Green means they have. White means they have not. We can put in the authorizations over here. You'll notice for skin products and images, most of the parents are going to say yes, but those who say no, we highlight it in yellow. We do the opposite for medication administration because most of the parents are going to say no, so we highlight the yeses. Over here on the right are two of our most important and powerful tools. You remember we entered into the form the date of the last physical examination. This tool will automatically track for you whether the examination is still current, whether the child needs to get a new examination within the next 60 days, and it provides a countdown to tell you how many days are left until the health care form is expiring. And if it is expired, you'll know the cell will turn red and it'll say expired. This allows you to notify the parents in a timely manner that they got to not only have a new physical exam for the child, but they need to send you the healthcare form. The other tools are available as tabs down here in the spreadsheet. So let's take a look at some of them. The child worksheet tool enables you to locate any information for any child in seconds right on your desktop. You just click in cell B1, a pop-up list shows up, you select the child's name, and then the entire form with all of its information appears right on your desktop. You can scroll through the form and locate any information in seconds. We also provide a tool on the children worksheet to help you create a class roster. You just click on the little down arrow here for the class, select the class that you want. Here I've selected the orchids. Click the OK button, and in no time, you have a class list for all the children who are in the orchids class. Any information that's in your form can be added to this class roster. That's entirely up to you. Typically, we add their name, preferred name, gender, date of birth, language spoken at home, and if you have alternate schedules for children, we'll put the schedule in here as well. The children worksheet also provides you with birthday alerts. You can see that Noah has a birthday this month, so his cell turned green. And Chloe has a birthday next month, so her cell turns yellow. We automatically tabulate enrollment statistics for you, so you can see the number of children every day in each class and also the peak. This enables you to keep track of the child-teacher ratio and make sure you're not exceeding the authorized size of your classes. We can do the same for programs, and if you have grade school children, we can tell you how many of those are showing up every day. One of the biggest challenges for child care administrators is keeping track of the immunization status of their children. If you remember, we provided fields to put the number of doses into the form, and now this tool automatically tracks the immunization status for every child. Here you can see, again, completely automated, the list of children, the class they're in, and for every vaccine, the number of doses that child has received. If the number is up to date, then the cell is green. If the child needs another dose within 60 days, the cell turns yellow. And if the child is beyond the number of doses they need, then the cell turns red with NC in the cell telling you that that child is non-compliant. If the child is exempt from immunization, then the cells all turn gray automatically, so you know that child does not require any immunization. If the child is only exempt for the varicella vaccine because they've had the chicken pox, then only the varicella cell turns up gray. We also provide you with a complete compliance audit so you can know the number of children enrolled, exempt, and non-compliant for each class and for each vaccine, and will provide you with an overall compliance rate for your center. The parents worksheet enables you to automatically create a parent group email list. All you need to do is copy the email addresses from the email address column and paste them into the to field of your email, and then send out the email message to all the parents. As an option, you can also import all the parent contacts into your address book. Every address book for every email system allows you to import contact information from our spreadsheets. We'll also provide you with a tool to automatically create address labels if you send out any physical mailings. One of the most important tools we have is to automatically create the teacher card or the emergency card. And you do this again completely automatically without transcribing any information from the forms. As with everything else, we'll customize this to your particular center needs. Typically, we include class and schedule, parent contacts, pickup and emergency contacts, allergies, medications, skin products, conditions, special needs, diet restrictions, and authorizations. You can print these out to distribute them to teachers, or many of the centers we work with save the information electronically onto the teacher's smartphones or classroom tablets. This is very convenient when the children are taken off-site for a field trip or to a local playground, or if you have to have a facility evacuation, either as a test or for a real emergency. The teachers don't have to look around for those paper forms and carry them with them. They focus on getting the children out. All the information is on their smartphone or tablet. And by the way, if the teacher doesn't have that information with them, you can have it on your smartphone or tablet as well. Therefore, every teacher not only has the information, but has backup. And because it's electronic, you can, when there are updates, you can update your teachers in a matter of seconds automatically without their even knowing about it. We will provide you with the tools to automatically create a directory of children and parents, and as with everything else, the information in this directory is whatever you want it to be. If it's on the form, it can be in the directory. We'll provide a tool to automatically address letters or send email messages individually to each parent. Again, the information about the parents and children is automatically populated. You type your message around that. The administrator portal allows you to read, edit, download, or print the forms in the exact same format that the parents filled them out. This is, of course, access controlled. Each provider sees only their own children. No other provider will see your children. This is particularly useful for your licensing agent reviews. You open up your portal and you say to the agent, whose form do you want to see? And the agent says, let me see Ashley's form. You just click on this magnifying glass. Ashley's form pops up exactly as the parents completed it. The agent can scroll through. Those people who've had licensing inspections using our electronic forms have always been successful. So as we've said, there are benefits for the parents and teachers. The parents have no repeated information on multiple forms. The paper forms are always entering the child's name and address and birth date on every single form, and their own name and address on every single form. They enter it once, and it applies to everything. They don't have to copy or mail the forms. They're submitted electronically, and they have access to them whenever they want to see what they say. And if they have to update them, they can do it at their convenience at 3 o'clock in the morning on a Sunday, whenever any information changes. No emails, no phone calls. They just click the submit button. You've got the updated information. And they can re-register without having to re-enter any information that is unchanged. For the teachers, they know that the information is always current and always legible. And if you allow them to store it on their smartphone and tablet, it's especially convenient for them when they're away from the facility with the children. For the administrators, there are abundant benefits. They automatically track submissions for each child, receive alerts when health and registration forms are about to expire, automatically monitor immunization compliance, create class and program rosters, tabulate enrollment, create teacher cards, receive birthday reminders, create a directory, create parent email lists and address labels, receive updates from the parents, receive email notification as each form is submitted. They can automatically distribute the updated information electronically to the teachers. You can locate any information for any child on your desktop in seconds. You never have to transcribe information from paper forms. No forms are ever misfiled or removed from a child's folder. No one has to check the files to make sure everything is there before an inspection. And there's never any illegible handwriting. The forms will be accessible from multiple facility locations, and they facilitate licensing and accreditation inspections. One more topic I want to mention is the Child and Adult Food Care Program. If you participate in that, we can provide you with an electronic income eligibility form customized for each state, and I'll mention that the U.S. Department of Agriculture encourages the use of electronic forms for child nutrition programs. We'll provide you with an automatic eligibility recommendation. Here you can see we automatically calculate the household size and income, calculate the number of foster children, identify common income errors, track the expiration of the forms and provide you with alerts, and automatically provide you with eligibility determinations based on USDA guidelines. We'll provide you with a validation tool so you can check all of the inputs to the form. Here you can see that Millicent failed to tell us how often Mason receives his $113.73, and so that particular piece of information is highlighted in yellow. We know there's an error. Down here, the total income and household income and size are calculated, and here's our eligibility recommendation. Getting started couldn't be easier. You just complete a subscription application on our website. Send us by email your current forms and class names, which we'll use as the starting point to customize the forms for your needs. We'll send you a draft form for your review. Any changes, additions, modifications, corrections, deletions, anything that you need, we will make those changes to the form, and we will not be satisfied until you are completely satisfied. When you authorize subscription activation, we will send you all the tools and instructions you need to start collecting the information and registering your children and using the forms for all the tools that you've seen already today. And after your subscription is active, we will be here to answer your questions, update the forms if necessary, and provide any technical support at no additional charge. I'm very proud of the director endorsements I've received. Michelle and Kelly are wonderful, dedicated directors in their centers. They and the others who provided endorsements on our website have said you can contact them with any questions to validate everything that we've said here today. Our service is simple to use and easy to afford. If you have 100 or fewer children, the price is only $250 a year. And if you have more than 100 children, it's an additional $1 per child over 100. Everything you see here is on our website. You're welcome to contact me by phone or email. I'd be happy to answer your questions, and I look forward to working with you to help you replace your paper forms with automated electronic forms for child care providers.